Well, we have Dr. Gerald Andriole, extraordinaire, also a great friend, somebody that has really walked the same path to continue the legacy of Ralph Hopkins here at Jackson Hole Seminars. Nice having you here, Jerry.
Fernando, thanks for having me. It's a great meeting, my favorite meeting of the year.
Yeah,
you know that.
And I know, and I'm so honored. And to be honest, my best friends I met here at Jackson Hole, and thanks to Ralph.
Yeah.
And Ralph had really great conversations with you. You've known Ralph for so many years.
Yeah.
I mean, you now help us with the scientific board, putting the program together. It's very complicated, right?
Ralph set a high bar. I don't know how he did it, for all the years that he did it, but boy, he managed to humble the proudest, most accomplished academic urologist. But by the same token, you know what? If you were a young person and you gave a good talk and you defended yourself in the critique panel, you set your own credentials.
This was the meeting, and it is the meeting.
Yeah, it's a terrific interaction in real time between the critique panel, the audience, and the speakers.
And, now that you started the tweeting, I know that the world will pay attention to this meeting.
Well, yeah, we're bringing this meeting into the 21st century. I think that's what we're in now. And I think tweeting is one of the things. But I don't think we should ever change the core strength of this meeting, which is friendships among the speakers, the critiquers, and the audience. And by the way, we've all become friends because there's a lot of regular attendees at this meeting. But a rigorous defense of the position you're taking in your given talk. Data talks, bullshit walks. And that's kind of the legacy that Ralph established at this meeting so many years ago.
That's right. And everybody knows the great professional you are, the great laparoscopic surgeon, the great researcher.
Have you been talking to my mother?
No.
She would agree with you.
Well, yeah. And the great family man, but nobody knows what you really like, the things that you have a lot of passion. I know you're passionate about food.
Yeah, I love food.
And the Italian food is something amazing, and our Italian friends are missing.
Yeah.
But you also cook. Tell me a little bit about
trying to learn how to cook. And some of the tutelage I've gotten here from our Italian friends, from Margit, German, it's all about technique, and you get a little extra help than you would get on the Food Channel. Let's put it that way.
But for urologists.
Cooking for a urologist, it's more than just the Food Channel. That's why you got to come to the Jackson Hole seminars in urology, to learn how to cook. And you know what? That sort of fits well with the concept that we've become a family. That although this is a business meeting, when you share a meal and some drinks with your good friends, it's much more wholesome, bonding experience. And that's, like you say, over the years, we've become good friends. I've become good friends with a number of the other folks who attend this meeting very regularly. So it's been a very rewarding experience. And of all the meetings that I attend, let me just say it again, it's the best one of the year for all the reasons. The friendship, the academics, the interplay, the back and forth. Of course, the food is good. Of course, the skiing is good. Today, a bright, sunshiny day, we hiked in Grand Teton National Park, right under the Grand Teton Mountains. Nothing as beautiful as that. I've got pictures that I hope we're going to be able to put on the webpage. Just a lovely respite from your day-to-day hard work as a practicing academic urologist.
Right, and this bridge between academics and private practitioners, community urologists. I mean, we're a small group, and this bridge is actually established now because, I mean, there are a lot of urologists that come here and say, "Hey, Jerry," and ask you questions, and they don't have that kind of...
And you know what? I learned from them because many of the members of various private practice groups and the like are extraordinarily well informed, extraordinarily well read, and they also have a very practical approach to what they do. And I try to listen carefully because the groups that are successful for a reason. They're doing things right, and that means they're taking good care of their patients, and they're being efficient. They're not wasting resources. And I think there's something that all of us can learn from each other. It's not just the one-way street, you know, the guy in the ivory tower declaiming the truth. It's a much more back and forth collaborative interchange sort of thing.
And let's change a little bit the subject here. How about opera?
Oh, you caught me yesterday. So yeah, okay, the critique panel was going, they were talking about erectile dysfunction. Not my favorite topic. Although the people discussing it are some of my favorite people. But notwithstanding that, I put my headphones in, I was listening to Puccini's La Bohème, and I guess I got carried away. I don't know.
No, but you know, you have that passion too. I mean, that's a lot of great qualities, I think.
Yeah, I mean, you know, one of the talks that we had this year was about burnout.
Right.
One of the things that prevents burnout, we all work really, really hard. But people who work really hard may not get burned out because they have outside interests and because they take time to pursue those outside interests. You know, one of the factors associated with burnout is answering the question, do you have enough time to play golf if that's what you love, or do you have enough time to you know, work out, or whatever it is, you know, that floats your boat. If you answer no to that question, you're at risk for getting burned out. So, you know, you got to make time to do the things that you really love. And for me, it's we've touched on some of them. You know, playing golf is a good thing. Drinking wine, collecting wine, things along those lines.
And now in music and all those things, and when you travel all these different places, what is the common thread, the one thing you're always looking for? Because the science, you know, you will learn a little bit more, but what else?
You know, I'd like to have a heartfelt face-to-face with the people at the meeting, get to meet new friends, learn a little bit about the challenges that they face. I mean, we all know the same challenges of dealing with prostate cancer or some other urological condition, but we all also work in incredibly complicated environments at our hospitals, the health insurance in different countries and different places. There's all kinds of micro differences between us, and it's really enriching in a way to learn the challenges outside of urology that others are facing, and to see how clever they are in trying to solve those problems and deal with them.
And we talk nowadays about patient safety. And if you're burned out, you're under a lot of pressure, that will influence how you treat your patients, don't you think?
It has. There's a direct correlation with bad HCAP scores, you know, sort of patient satisfaction scores. Medical errors are higher. You know, you start alienating your staff if you come to work with a bad attitude, a chip on your shoulder. They're not going to do their job as well and as smoothly as they do. So, you know, we've got to take care of ourselves. You know, you got to be, in some respects, you know, your own physician, your own therapist. And we're all very smart. We're all very willing to work hard. We've got to recognize who we are, what we like, and just take care of ourselves and make sure we can get and do the things we want outside of medicine.
And Jerry, I'd like to thank you again, because it's you, people like you and Margit, that really helped me and helped everybody to continue the legacy of Ralph Hopkins. And
yeah, it's real easy. You're a great example, a terrific role model, and you know, this is just one part of what you do. Your educational efforts, your outreach internationally is something that we all admire and aspire to.
Thank you so much.
All right,
Thank
buddy.
you.
Appreciate it.
Thank you.
All right.